event this evening. I'm a small business owner and have a small agency. As an independent insurance broker, I've been a student of the healthcare industry now for over 25 years. I'm here this evening on behalf of the National and the Southern Arizona Association of Health Underwriters, the compass that Dr. Carmona spoke about. In addition to representing thousands of individuals and employers in Southern Arizona, we also work closely with those thousands and thousands of employees that are currently covered by their employer-sponsored health plan. Not only do we help individuals and employers analyze and compare competing health plans, but we assist them in making the choice as to which health plan best fits their needs. In addition, we work as advocates when there are problems with the billing, the claims, and the coverage issues. As a result, we bring a unique, consumer-driven view to the healthcare reform debate. Frequently, we find ourselves representing many of the stakeholders in healthcare: the patient, the true user of the system; the plan supplier, such as an employer; providers, such as physicians' offices, hospitals, pharmacies, and such; as well as the payers, such as insurance companies, plan administrators, Medicare, and other public health plans. The topics surrounding healthcare reform are numerous: individual mandates, employer mandates, market reforms, a national exchange versus a purchasing pool, subsidies and premium assistance plan options, wellness programs and cost containment, transparency issues, medical information technology, financing, and a government-run public plan option. Fortunately, we've all just been given a few minutes, but I think we're all working towards the same thing: affordable access for all. The real debate is what should be, or perhaps what should not be done to achieve this. Something very basic has yet to be mentioned this evening, or at least in simple, straightforward terms. When we talk about the cost of financing health care or health insurance, we must understand that the reason it is so expensive is because the level of health care we have come to expect and demand has become very expensive. For generations now, we've come to want and expect the highest level of health care at any time. If I have a headache, I'm no longer satisfied to be told, take an aspirin, and if I'm not better in the morning, call my physician. Rather, I want my physician to prescribe, and he or she will do so, full exams and workups, including a raging test, and even that MRI in case it's that 1 in a million brain tumor. Why? Because it's all $20. We've lost the connection, as several have said this evening, between the service we request and the cost of providing it. And we're not willing to wait for it. We have multi-million-dollar machines and other diagnostic and treatment equipment and facilities spread all over town. So when we want or need it, it's a matter of days, sometimes hours, but not weeks or months before we have access. We have thereby created a demand and an expectation for the highest level of care for all.
Not in this country.
A single-payer system, or even just a government-backed plan option, would create a huge cost burden on privately insured individuals. Public plans such as Medicare, Medicaid, Access as we know it here in Arizona, CHIP, and other public health plans already pay less than actual costs to those providers. They do this not through competition, negotiation, or any sense of a cost reimbursement, but by coercion. Is it fair or right when one participant, who also regulates and sets the rules, is able to pay its providers less, while private participants must pay their fair and full cost, as well as additional amounts to subsidize those public plans? This is called cost shifting. And instead of so, this cost shift is already costing the average insured family an extra $1,500 per year. What happens when those private insurers, the numbers are reduced so much or become non-existent, there's no one to make up that difference? Yes, the complexity of the solutions are immense. And yes, we need to regulate and reform our current private system. Let's eliminate the underwriting process and pre-existing condition restrictions that bars many people from obtaining coverage. Let's use our finite resources to stop the cost shifting and make the current public plans pay their fair share of costs so as to level out the playing field and allow private plans to reduce their actual costs. In addition, we need to provide a better and broader process of providing subsidies and premium assistance programs for low-income individuals, families, and businesses to help them purchase the coverage they need. Let's look at long-term and create wellness programs and cost containment incentives in both private and public health plans, and let's all work towards a healthier America.